Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, July 15th, and this is my daily briefing. To date, we've had 144 cumulative positive cases in Missoula County. 141 of those cases were identified by testing, and 3 were epi-linked. We've had 103 recoveries and 1 death. 1 Missoula County resident remains hospitalized, and there are currently no hospitalizations in Missoula County from other counties. We currently have 40 active COVID-19 cases with over 320 close contacts. Active cases and their known contacts are in quarantine and isolation, and they'll continue to be monitored and supported as needed. When looking at all of the cumulative cases that we've had to date in Missoula County, 54% have been a contact to a confirmed case, 23% have been related to travel, and 23% have been from community spread. Now, if we just look at the new cases that we've had in our new spike of cases since the beginning of June, 58% have been a contact to a case, 19% had been related to travel, and 23% have been community spread. And I just want to remind everyone that the state of Montana's DPHHS map and their website is sometimes going to report some different numbers than what we report locally. We have the actual numbers up through the time that I record my daily briefing. Sometimes there's a little bit of a lag time. Today is one of those cases where we are reporting 144 cases and they're only reporting that we have 130. So I'm sure that it'll get caught up and reconciled. But I just want to let you know that our numbers are the most current. The state of Montana is reporting 2,096 cumulative COVID cases, which is up 145 cases since yesterday. There are now 1,147 active cases with 37 active hospitalizations across the state, and there have been 34 deaths related to COVID-19 statewide. So today I'd like to share a few reminders about testing, both locally and nationally, as well as let you know what business owners and customers can expect in the coming days. First, you might be wondering why I'm not wearing a face covering while providing my daily briefing. If we look into the rule, it indicates that a face covering is not required when an individual is fully separated from other people by a protective barrier, such as when working alone in a separate office, which is the case when I'm recording my daily briefing videos, as well as the majority of my work day is spent alone in my office, recording the video from my computer with the door securely closed. I do have many face coverings, and I wear them along with all the other staff members when we are inside our facilities and unable to maintain 6 feet distance between us. Face coverings are required inside the health department by staff and the public, and we staff wear those coverings when we're walking through the hallways, if we are in smaller meeting rooms, and in other spaces where we cannot maintain 6 feet of distance between staff. Now, I'd like to remind everyone that we experienced a significant delay in receiving Sentinel testing results. This delay was outside of our hands and was directly related to an out-of-state lab's capacity to process the tests and send back lab results. We received all of these results over the weekend. Actually, I believe it was late Friday. Infectious disease staff have tried calling all of the patients awaiting for those results. They were able to connect with a handful, but most were not available to answer the call at the time that it was placed. All patients received their results confidentially through a formal letter. So this week, staff are working away at sending out those Sentinel testing results as quickly as possible, in addition to balancing their current caseload, including supporting active cases and close contacts. So please just bear with us. Also related to testing in general, we have learned that there is projected to be a nationwide shortage of reagent that is some of the liquid that's used to process the COVID-19 tests at the lab level. Again, this is not an issue that was created locally, nor is it a problem that Missoula County anticipates having to solve alone. It's a nationwide issue, and higher level leadership inside and outside of Missoula County continue working to minimize any detrimental effects from this projected shortage. We continue working with stakeholders across the county and consulting with our state partners as needed. Health department staff routinely connect with hospitals, clinics, jails, detention centers, schools, long-term care facilities, the university, businesses, and others to ensure continuity of operations across the county. These weekly and bi-weekly remote calls ensure that both stakeholders and the health department remain in ongoing communication so that we can share accurate and relevant information efficiently, as well as to identify any needs as they arise in real time and problem solve some solutions together. Our environmental health staff have been working on helping businesses and customers understand how to implement and comply with the Missoula County face covering mandate. They've been fielding hundreds of calls and emails from business owners and community members about compliance and enforcement. Additionally, they're working on a set of FAQs related to implementing and complying with the face covering rule, which should help community members understand what's expected of them when inside public settings, as well as help business owners and employers understand how they need to implement the rule, promoting staff and public safety in their internal public settings. This set of FAQs should be finalized and available by the end of the day today. We're also working on business guidance, what to expect if you have an active COVID-19 case in your establishment, which shares information about what an employer can expect if and when there's a positive case associated with their place of business. We discuss what case investigation and contact tracing looks like in that situation, and we also review what cleaning, sanitizing, and other safety measures will need to be taken in order to ensure the health and safety of the environment after the active case and close contacts have been quarantined and isolated. The document also reviews patient privacy and confidentiality and reminds employers that the health department is bound by HIPAA and follows best practice to safeguard patient privacy and confidentiality. This business document should also be finalized and ready by the close of business today. Both the FAQs and the guidance for employers will be shared on our website, posted to social media, and shared with our media partners. You may have heard that we identified and secured a new testing site for our county drive-through testing facility. The new site will enable us to continue serving county residents in a safe and effective manner through all of Montana's seasons. We're in the process of completing agreements, and we're hoping to move into our new location over the next few weeks, and we're looking forward to getting our nurses into a sheltered environment with appropriate air conditioning for summer and heat in the winter. This facility will still serve as a drive-through testing location. It's just going to be more sheltered. We'll share more information once it's finalized, but the location is out on Flynn Lane on the west side of town, if anyone is curious about that. We are hopeful and confident that this new site will serve the community well in the coming months. So that's it for my daily briefing today. Thanks for everything you're doing in Missoula to help us keep our communities safe. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CINDYFARR. Click that little notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. Again, I just ask that everyone remain kind on that page. We do appreciate a healthy debate, but we would like everyone to please remain respectful. You can call 258-INFO if you are having symptoms of COVID-19 and you would like to schedule a test through our drive-through testing facility. And you can check out our website at missoula.co/cvirus. So until tomorrow, everybody, stay healthy.